Let's get started. Good afternoon and welcome. My name is Bonnie Saxman. I'm the president of First Dragon/CME. We are very excited to show you the AZZLY solution paired with Dragon Medical One today. For those of you not familiar with AZZLY, they offer an all-in-one addiction treatment and behavioral health care specific EHR. On our panel today, we have myself, Derek, Maria, and Matt. Derek Dorado is VP of Business Development for AZZLY and will be presenting a few slides for us today. He is also available to field any questions you may have regarding the AZZLY Rize EHR. Maria is AZZLY's product manager and will be showing us a brief demonstration of how to incorporate Dragon Medical One into the AZZLY Rize clinical workflow. Matt is also on our panel today, and he is our Dragon Medical One Client Relations Manager, and will be fielding your Dragon Medical One related questions during the question and answer session following Maria's demonstration. Next slide, please. Today we have a few slides to review, and we'll then conduct the brief demonstration I referenced earlier. We will have two polls that will appear after the completion of the demonstration today. We would greatly appreciate your feedback, which will help us gauge future content for our webinars in the future. Feel free to interject your questions anytime throughout our session with you today. Derek will be presenting the next two slides on AZZLY Inc. and their solution, AZZLY Rize.
Thank you, Bonnie. Next slide, please. So good afternoon, everybody. I'm proud to introduce the AZZLY Rize solution here. So founded in 2009, we've been servicing the behavioral health and addiction treatment industry for the last 9 years now. And over the last 9 years, we have grown to serve programs all over the country and are proud to remain US based. Next slide, please. So our solution, AZZLY Rize, is a full suite solution that includes intake, telehealth, clinical, medical, patient engagement, bedboard, and revenue cycle management modules. In this webinar, we have Maria Gray, product manager, that will be showing off the AZZLY Rize solution today. Next slide, please. Back over to you, Bonnie.
Thank you, Derek. So a little bit about us. We have been offering customized speech recognition solutions for over 23 years as a nationally recognized elite partner with Nuance Communications. Our training and support teams are also US-based and focused on our clients' ultimate success. Next slide, please. Some of you may be familiar with our legacy box version, Dragon Medical Practice Edition, which has recently been sunsetted. Dragon Medical One is the latest and greatest in front-end speech-to-text technology. As I mentioned earlier, Dragon Medical One is our state-of-the-art cloud product, offering affordable subscription-based pricing, which includes all support, updates, and upgrades. Next slide, please. This slide reflects some of the advantages of using Dragon Medical One compared to our legacy product, Dragon Medical Practice Edition. Dragon Medical One is a HIPAA-compliant tool, allowing providers the ability to complete their patient visit notes up to 45% faster and saving up to 2 hours per day. Next slide, please. We have actually found that more and more providers prefer the mobility and flexibility of using Dragon Medical One with the PowerMic mobile app. The PowerMic mobile app turns a smartphone, whether it's an Android or an iOS phone, into a wireless dictation device. For those of you currently using a PowerMic 3 handheld microphone, note that that microphone software is also integrated into the DMO software and offers another option for recording your narratives. Next slide, please. Do we have any questions at this point? Okay, I don't see any. We are now ready for the brief demonstration by Maria, showing the high level of compatibility between AZZLY Rize and Dragon Medical One. Take it away, Maria.
Thank you, Bonnie. Good afternoon, everyone. So today I will be actually using the Power Mic mobile app on my phone as I demonstrate within our AZZLY Rize application using a test patient, completing a dictation portion of a set of partially completed provider orders. So as you can see, I have already filled out part of my orders and I'm ready to begin my dictation. As I go through the dictation portion today, I will begin first with straight dictation. Then I will be using a macro phrase that was previously established that will automatically populate a paragraph for me. Then by using the command select, I can modify portions of any part of my dictation automatically. So I will begin the dictation portion now. 28-year-old female patient admitting to detox level of care period. Patient reports drinking 2 to 3 liters of hard liquor daily for the last 3 years period. Patient previously treated for this issue and reports 1 year of sobriety prior to relapse period. New paragraph. Alcohol detox orders. Select 500 milligrams, 750 milligrams. Select BID, TID. So I have stopped my dictation, and as you can see, my direct dictation displays in the top portion. After stating new paragraph, I was able to space down a full line. And then by using the macro phrase alcohol detox orders, it populated that second paragraph. And then by saying select, I could choose a word or phrases within any portion of my dictation and then state what I would like that selected phrase to be replaced with. Simple to use. So with that, I will turn it back over to Bonnie.
Thank you for that awesome demonstration, Maria, showing the compatibility, high level of compatibility between our solutions. So I guess next we'll start with our polling questions. The first question will pop up on the screen and we'd appreciate a response. Are you interested in viewing a full demonstration of AZZLY Rize? We'll give you a few seconds to answer before we go to poll the question number 2. All right, let's go on to question number 2, please. Are you interested in scheduling a free trial of Dragon Medical One? Okay. So let's move on to questions that you may have. I'm going to hand over this part of the presentation to both Matt and Derek. Matt will answer any questions you have regarding Dragon Medical One and Derek regarding AZZLY Rize.
Thank you, Bonnie. Let's see, I do see a number of questions have come in. Let's start. This first one is regarding AZZLY for you, for Derek. I'm looking for an EHR for my small business. Would AZZLY Rize support IOP behavioral health?
Thank you for that, Matthew and Bonnie and Maria for the presentation. To whoever asked that question, yes, we do. IOP and OP programs are a big chunk and population of the folks and programs that use AZZLY Rize. So the answer to that is absolutely yes.
Okay, thank you, Derek. And let's see another. We're getting a good flow of questions here. This next one I'll tackle. It's for Dragon Medical One. Are there any DMO discounts being offered to existing AZZLY clients? Yes, there are. Please contact us and we'll be happy to assist with a proposal. We can also offer a trial at no cost or obligation so that you can conduct your own proof of concept. And let's see, another question. This one will be for you, Derek. I am looking for an electronic record system for a relatively small startup. We will provide IOP/OP substance abuse services, period. Oh, sorry, I'm used to dictating with Dragon. We will not be needing the medical piece. What can you offer us?
That's an excellent question. We work with a lot of startup businesses, so don't let you being a startup or maybe being financially bootstrapped, as they say, disencourage you from looking for electronic health record solutions. Anything is better than paper, whether you're going to AZZLY or something else. But AZZLY works with a lot of startups. We would be happy to help you out in your evaluation of EHR programs. What I would ask is go on our website, maybe take a look at a little bit more information that we provide specifically on IOP programs and how we service them. And if you feel so inclined to learn more about our pricing, kindly fill out a contact form and we'll have one of our representatives reach out to you right away.
Thanks, Derek. This next one is a Dragon question. Is DMO licensed per machine or per user? So Dragon Medical One is licensed per user. Each user license can be installed on limited Windows devices. Pretty good question there. And this, I think we have two questions coming up here for you, Derek. This first one, do you integrate with Salesforce? Oh, hello, Derek, you might be muted there.
I'm sorry for that. Yes, the question was in regards to our integration with Salesforce. Yes, we do have an integration with Salesforce and are very open to any other integrations as a team.
Okay, thank you, Derek. And there was one coming in right after that. Can forms in AZZLY be customized?
Yes, all forms are customizable and configurable to your needs, whether you like the layout to have different drop-down options, checkbox options, narrative-free text for you to have easier dictation functionality. All of that is configurable and customizable for your needs.
Okay, thank you, Derek. This next one looks like a Dragon question. We've received actually a couple questions asking about the additional cost and pricing per user. It's a subscription pricing model, a SaaS model. If you'd like to contact us, we'll be able to assist with a proposal showing the discounts we can offer. Also note that the subscription pricing includes all of your updates, upgrades, and unlimited access to our in-house US-based support team. And see a couple more AZZLY questions coming in. So regarding AZZLY, Derek, does this program come with a calendar for scheduling?
Yes, it certainly does. And not only do we have calendar and scheduling functionality, but the calendar and scheduler also is tied to a telehealth solution, as well as it also has the functionality for appointment reminders to be sent out, as well as confirmed right back into the system via text, phone call, and email.
Okay, thank you, Derek. And let's see if here's a Dragon question. If the trial is successful, how long does it take to get ramped up with a DMO production license? So that's a great question. So we do offer the 7-day trial at no cost or obligation. If deemed successful, you would submit some paperwork to our accounting team. They will create your account in the admin portal and send the steps to log in and finalize. Once that's completed, we're supposed to say that the license will be ready for use within 24 hours, but usually it's in 1 to 3 hours, sometimes immediately. So it is a fairly quick turnaround going from the trial to production license. And let's see. I think that wraps it up. Let me see. And we have another Dragon question about the licensing. So it is each voice profile is tied to each user license. So it is licensed per user. Each user will have their own login to access their voice profile with their custom commands, custom vocab, as well as their linguistics and voice profile settings, all of that in there. And I think that might be it for questions. Do we have any other questions? Derek, did you have anything else that you wanted to add at all in summary?
No, what I would like to share though, again, is that we offer a very affordable solution for folks that maybe are questioning if they're too small or too new in their program's development for an electronic health record. I would highly encourage you to reach out and see if we could work out pricing for you. We do have a full suite solution. So whether you are looking for something on the clinical side, reporting side, billing side, medical side, or intake side, we offer a plethora of different solutions for you. So stop on by our website, check us out. And if you're interested in hearing more about pricing or seeing a full demonstration of AZZLY Rize, drop your information in the contact area and we'll reach out to you.
Thank you very much, Derek. Bonnie, back to you.
Thank you, Derek and Matt, for fielding today's questions. Next slide, please. Note that each of you has been entered into our raffle for your choice of either a PowerMic 3 microphone or an Amazon gift card, and you will be notified if you've won. Next slide, please. So we'd like to thank Derek, Maria, and Matt for being on our webinar panel today, and each of you for taking time out of your busy schedule to attend this webinar. Feel free to contact us if we can be of any further assistance. My information is on the left, Derek is on the right, and we're happy to help in any way we can. Note that this webinar is being recorded and will be emailed to you once it has received its final edits. You will also receive updates on our upcoming webinars. So thank you again for attending, and until next time.